To become familiar as possible with the types of questions that may appear on the exams. Knowing will help alleviate fear and anxiety. An alternate item format question is presented in a format other than the four options multiple choice. You will encounter these questions on your nursing exams and NCLEX exam.
The first type question is fill in the blank. They'll ask you to perform a medical calculation, calculate a flow rate or infusion time for a specific intravenous solution, or calculate an intake or output record on a client. Always follow the directions accompanying the question. Use scrap paper to perform the calculation. Read the question and set up the formula you'll use to solve the problem. Be alert to the need to perform conversions. Perform the calculations, verify your answers using a calculator, and record the answer using 1 decimal place. The next type of question is multiple response questions. You'll be asked to select or check all of the correct options that pertain to the questions. Always read the data carefully. Determine exactly what the question is asking. Identify strategic words. Note if the question contains a positive or negative, then query. Use nursing knowledge and clinical learning experiences. Think about the pathology associated with disorder if disorder is presented. Visualize and form a mental image of the situation in the question. Read each option to yourself one at a time and think to yourself, yes or no. Expect to encounter several questions in multiple response format on the NCLEX exam.
All right. Prioritizing. You may be asked to use the computer mouse to drag and drop the answers presented in the order of priority. 3 helpful strategies: ABC's airway, breathing, and circulation. Directs the order of action. CAB guidelines if administering CPR, circulation, airway, and breathing, and Maslow's hierarchy and steps of nursing process. Use the ABCs. Use Maslow's hierarchy of needs. Steps of nursing process. Look for strategic words. Determine, identifies positive or negative events in query. Visualize and form a mental image. Use teaching and learning principles. Client's readiness to learn is a first action. Hands, wash first. Treatments and procedures always explain to the client. Nurse checks for signed consent form before any invasive procedure and document. Figure or illustrations. You are provided with a visual item and you need to answer the questions based on that item. Read all of the data carefully and focus on the figure and or illustration. Think about what the figure is representing. Ask yourself, what is the question asking? Focus on the subject of the question. Look for strategic words. Determine if the question identifies a positive or negative event query. Use nursing knowledge and clinical learning experiences and focus on the question format.
The next type of question that we discuss in this chapter is charts and exhibits. Take in all data of the chart or picture provided. Avoid skimming the information so you don't miss anything. Identify relationships between the picture and the chart and the subject of the question being asked. The question format after that we discussed is graphic item options. Look for strategic words within the questions to help identify the answer. Note the format of the question presented. Once you determine the subject and identify what the question is asking, examine each graphic option to choose the best answer.
Answering audio or video questions. These require you to wear a set of headphones. You can click on the icon to play sounds or video. Focus on the subject once you determine what the question is asking. Note the format and use nursing and knowledge skills. A study tip: audio and video type questions ask you about a subject or content area that is within the nursing scope of practice. It requires you to listen to breathing sounds, heart sounds, or bowel sounds, representing a component of a nursing assessment. Video questions will most likely present nursing activities and procedures that you encounter in a clinical setting. Testlet questions. These include a client scenario and several accompanying practice questions that relate to the content. Any format, read all of the date and end the case scenario. Avoid skimming over the data. Note the question format presented. Use specific test taking strategies. Review the case scenario for each presented question. And use nursing knowledge and critical reasoning skills and clinical experiences to answer correctly.
Say good luck, group 5.